Good morning. Welcome everyone to today's webinar. Welcome to the Empowering People and Community series, supporting tobacco cessation in the new year, leveraging the Quitline to support community. Again, welcome. We're happy to see you today. Thank you for joining us. A little bit about the Empowering People Community series that is offered to you or being brought to you by the Louisiana Campaign for Tobacco-Free Living. It's equitably bringing health, education, resources, and hope to people, populations, and communities in Louisiana. Today's learning objectives are to explain the role of tobacco quit lines in supporting individuals who are ready to quit, including services offered such as counseling, referrals, and nicotine replacement therapy. Identify strategies for connecting community members to Quitline services with the emphasis on reaching populations disproportionately impacted by tobacco use, and apply Quitline resources within community and organizational settings to strengthen tobacco cessation efforts and support sustained behavioral change in the new year. I am your moderator for today. My name is Michelle Oza. I am the Social Health Disparities Lead for the Louisiana Campaign for Tobacco-Free Living. And today we'll have two wonderful speakers speak with us today about the Quit line and our Quit resources that we have in this great state of Louisiana. First up, we'll have Ms. Chriselle Stipe. She is our Senior Program Manager for Health Promotions, and she will get us started. You're on mute, Chriselle.
I apologize for that. Just wanted to say happy late New Year to everyone, even though this is the end of January and it's almost February. It's never too late to make changes, to make lifestyle changes within the new year. So basically becoming that new you in the new year of 2026. And so we just wanted to focus this webinar on the new year and with everyone thinking about and working on changing themselves regarding their health, lifestyle, and well-being. We thought it would be perfect to talk about tobacco cessation and quitting tobacco as one of those behavioral issues that people have difficult time quitting. So to start off, just wanted to provide some information regarding Louisiana tobacco use. If you look at the left, this is just our overall smoking prevalence, and I just want to make that difference clear. When we're talking about smoking, we're talking about combustible tobacco that you actually have to light and burn. When we're talking about tobacco use, we're incorporating all types and all forms of tobacco and nicotine products, which would include the smokeless tobacco, vape products, and just the ever-changing tobacco and nicotine products that are being put out by companies. So just a quick reference to that as we look at these numbers. And if you can look at the left side, you'll see from 2016 up until 2023 that the overall smoking rate has decreased in Louisiana, which is has to do with a lot of the statewide tobacco efforts that has happened. And so you're seeing that percentage decrease regarding combustible cigarettes. But if you look on the right side, you'll see an illustration of tobacco use, which incorporates all types of tobacco. So right here, we're comparing 20% of US residents currently use tobacco, but compare the state prevalence to, I'm sorry, the national prevalence to the state prevalence of 26% in Louisiana. So Louisiana tobacco use is still higher than the national average. Next slide. And this is just another illustration, another comparison of Louisiana percentages compared to the US. And so that 26% includes tobacco products such as cigarettes, vapes, and smokeless tobacco. Next slide. So when talking about, after looking at the prevalence rate in Louisiana, there are best practices based on CDC best practices for tobacco cessation. And best practices show that counseling along with medication provides a more successful opportunity for people to quit. So not only medication alone, not only counseling and behavior modification alone, but those things together prove successful for people to quit. Regarding the medications, we have products called nicotine replacement therapy, which we call NRT, nicotine replacement therapy. That means there's a small amount of nicotine, or really a safe amount of nicotine in those products to help a person deal with withdrawal symptoms from trying to quit. And it helps them to maintain those symptoms. Because when people experience extreme withdrawal, guess what? They go back to smoking or they tend to relapse. There are other products that do not have nicotine in it, which are medications. As you can see, bupropion and varenicline are the generic names for Wellbutrin and Chantix. The over-the-counter products are usually the patch, the gum, and the lozenge, and the other products require prescription. As far as counseling, and of course, counseling types have changed over the years with new technology and how people receive their information. Of course, originally we had in person, there's group and individual counseling and also telephone counseling, which we'll be talking about today with the Quitline. In addition to that, there's self-help materials. As years have progressed with technology, now there's online counseling and also text and app coaching. So with the Louisiana Tobacco Quitline, our program is called Quit With Us Louisiana. And basically it's a partnership that developed between TFL, the Louisiana Campaign for Tobacco-Free Living, and the Louisiana Department of Health, their Well Ahead Tobacco Control Program. And so both programs actually lead and manage the Quitline services within the state. Quit With Us Louisiana basically provides the tobacco cessation services and important information for tobacco and nicotine users. And we both share efforts, both organizations share efforts in informing, educating, and increasing access to services for the communities. So I just wanted to provide just some videos um, of some influencers, some big name folks that we know here, on and show you how we actually promote cessation services and how we're reaching communities, and how we're letting communities know that they have access to this resource. And actually having someone who is well known in communities across the state to talk about their journey, to influence folks to access these services to help them is really valuable. So here I'm just showing you an example of Wild Wayne. He's a DJ in New Orleans, a great personality in the area. He has deep ties within the city regarding music and media. He's a former smoker, and he actually utilized the Louisiana Tobacco Quitline, I want to say back in about year 2019. And he has talked about his journey on the air. He has spoken to different crowds regarding his journey and promoting Quitline services within the state. He was also engaged in a large media promotion which was the 10-year anniversary of the New Orleans becoming tobacco free. And so he spoke about his journey, and he has been successful utilizing the state Quitline. And we will play that video now.
What's up, y'all? It's your boy, Wild Wayne, man. I'm trying to let y'all know that today is a great day to stop smoking. I smoked for decades, literally. But one day, when the coughing was bad, when I felt like my voice was changing, I had to stop. And I did have assistance. I got with quitwithusla.org. I got with 1-800-QUIT NOW. I got with the program and stop smoking. Now, part of it is mental. You have to be ready. And I encourage people all the time that now is the time to stop smoking. But with their assistance, they make it a lot easier. You get the free nicotine patches, and they will curb that desire for the nicotine, all right? And then they got people on deck ready to help you, to take your call or take your text to help you get right. Go ahead and text READY to 34191 or call 1-800-QUIT-NOW or visit the website quitwithusla.org and stop smoking today.
Thanks. I'm glad we were able to play that. Next slide. Also, we've used testimonials and stories of people across the state who's um, gone through trying to quit and dealing with mental health issues. I'm sorry, not mental health issues, but um, physical health issues and chronic diseases related to tobacco use. And so we have a testimonial here of Mr. Mike Baylock. He struggled with chewing tobacco. He began chewing tobacco at age 13. And because of this, he developed throat and jaw cancer, and it resulted in his lower jaw having to be reconstructed. Mike Baylock, he became an advocate for smoking cessation and telling his story. He was a member of the Men Wearing Pink organization for the American Cancer Society. And unfortunately, we lost him. He lost his battle with cancer, and we lost him as an important advocate. But we are passing along his message and his testimonial, which he hopes and we hope that, people will take heed, and it will, motivate and direct folks to, actually work on changing their habit and work on addressing their addiction.
Hi, I'm Mike Blaylock, and I'm an oral cancer survivor. Somewhere around the age of 13 is when I had my first experience with smokeless tobacco use. I knew the warnings, I knew the dangers, but like everybody else, I said, it's not going to happen to me, that'll happen to somebody else. Never thought I was addicted to it. Always thought I could give it up at any time. It really had a stronger hold on me than I thought. I tell people now, the day I was told I had cancer, I never touched it again. The fear of them having to maybe approach their family, the guilt that I have to live with every day because of what I've done to my family, should be enough for them to say, I don't want to go through that, and quit.
Okay, thanks for playing that. And Mr. Mike, he is actually from Covington, Louisiana. And the previous video was Wild Wayne, and he's a DJ in New Orleans, which is, his area reaches many in the southeastern part of the state. And just to let you know, in addition to that, recently we've done worked with influencers in different parts of the state, basically using social media to reach folks and showing folks, telling the story. And the voices of influencers are really powerful for people of all ages that utilize social media. So just wanted to share that with you, and hopefully you can share this video with those within your community who needs to hear this and needs resources and access and motivation into those steps of quitting. Next, I'm proud and happy to introduce Paola Klein. She is our senior client manager with RVO Health. RVO Health is actually the Quitline services that provides coaching and services to Louisiana tobacco users. So the Department of Health and TFL, we work really closely with RVO Health and PO here to make sure that services are easily accessible, and we're constantly trying to improve services across the state for people to access. Poe has almost 20 years experience working in tobacco cessation and over 10 years working with Quitlines. And I'll turn it over to Paola.
Thank you, Chriselle. And what a great story that you guys have captured with those interviews and those testimonies. They really can resonate and motivate people to make change. A change that is hard. But yeah, I'm Paola Klein. I'm client manager at RVO Health, working with the state of Louisiana. Very honored to work with you guys. And what we're going to talk about today is looking at some Quitline stuff. Next slide, please. A little brief on about Quitlines and their effectiveness, and then we're going to look at services. Next. So what is the Quitline? So we are like Chriselle mentioned, things kind of started off in telephone and have now expanded to texting, to live chat with coaches, to interactive dashboards. We've grown so much in what Quitlines have been around since the 90s and just ever evolving to meet people where they're at in their quit journey and how to quit. We also provide resources like quit guides. We've expanded it to other things in our text program where people are just a little more interactive and more engaging. So very excited about that. And overall, just really committed to helping participants quit, right? When we talk about tobacco, we're talking about commercial tobacco and not the sacred use of tobacco that's used in Native American populations. And also making sure we're using evidence-based treatments. So, like I mentioned, the coaching, the web support, and the NRT, and continuing to be a part of research in helping people quit tobacco. Next. So, how do they work? Do they work? Yes. So in 2008, which is you saw the little screenshot of best practices that Chriselle had on her slide, but that's when we learned how effective are quit lines and how do you combine it with NRT? What does that look like? So we learned that if only using the quit line, nothing else, was 13% success rate. Medication only, so those NRTs and stuff, 23%. But when you combine the counseling, coaching with an NRT or a medication, you increase your chances of successful quit attempts to 28%. And then the 2020 Surgeon General's report found that combination therapy increases your chance of quitting as well, and even more so. And we learned that short and long-acting NRT increases successful quit attempts. So your long-acting NRT is like that patch, and your short-acting is the gum or the lozenge. And combining those together really help our folks who are highly addicted and successfully quitting. And also that report showed that text messages are effective and they are helping people when they're making their quit attempt. Next slide. So what does it look like? Our goal is to customize the quit attempt for each individual. There's no one size fits all when you're quitting tobacco, right? So in Louisiana, there are different programs and tracks and things to ensure that we're supporting people in and how they're going to make their quit attempts. So our standard program, which you might see if somebody's enrolled or asking questions, is kind of called our Quit for Life program. And that's 5 sessions and offering group session. It's the online portal, and it's just really addressing, and this is with everyone, addressing individual needs and personalizing the plan and getting to that NRT that's going to be effective. I'm going to come back to the Live Rate Free one because I want to walk you guys through those last 3 over here. So menthol users, there is a high percentage of menthol users, right? So we created and we train our coaches in this area because people who use menthol products are more highly addictive. And so it is a bit of a harder addiction than standard tobacco use. So we want to tailor and engage people with that information and help them understand kind of the even more dangers of using menthol products and also addressing the health equity gaps. So we know that certain populations are targeted to use menthol products. So our coaches really just have those conversations, help them understand those things, and move folks to just that understanding that menthol products. I don't know how else to explain. I don't want to get too deep in the weeds, but and also working and supporting our states who are advocating for bans on menthol products. We have a pregnancy and postpartum track. So individuals who call in who report being pregnant, planning to be pregnant, breastfeeding, or postpartum can go in, and our coaches understand their unique need in being pregnant and postpartum. So again, just like standard, they're going to get those calls, those group sessions, online portal support, online chat, text support, and they have a bit of a few additional sessions to support them during this audit tip. And the focus is really on if they're planning and when they're postnatal and getting them NRT to support them. To get NRT for this population, it does require a medical override. And then we have what we call our behavioral health track. So very similar to the pregnancy one, the additional sessions and our coaches, really understanding the behavioral health that condition that this individual may need. So we may experience some longer calls, some additional support and conversations. Those are our coaches are trained on that. And so those one-on-one calls, the group sessions, and the tailored treatment. Now, going back over to this Live Vape Free section, this is really targeting individuals who use vape products. And it's also for adults ages 18 to 26, so young adults, and then our teens at 13 to 17. Now, the 13 to 17 age do not receive nicotine replacement therapy, but do get all the same support that the young adults are getting via interactive content, text, and an online dashboard, while our young adults are able to get nicotine replacement therapy and also receive the same text interactions and strategies and things. So these are all of our modalities and everything that is offered in the state of Louisiana. Next slide. So what does it look like when you or a participant comes to the Quitline? So first is going to be, right, that phone or online enrollment or even a referral, right? So providers, partners in the state can make referrals, and then we outbound attempt to get folks involved. Those first two sessions are going to be one-on-one, and I call them sessions because they don't have to be just over the phone. They can be via text or online chat. The third session is that quit date. We're really hoping to get folks to that quit date by that third session. So the remaining sessions, we really work on the relapse prevention. That's what I was trying to say. And continuing to work one-on-one with a coach. By the fifth session, we do offer the option for an online group. Some people might like that, being with other people, having that support. In our online group sessions, participants cannot see each other. They can only see the facilitator, and they can interact with each other in the chat. And that's just for privacy purposes, but still allowing the opportunity to engage with one another. So all of these sessions come with daily action steps, emails and text reminders, milestones and reminders, and trackers. You can use the online trackers to set goals. They can also track their NRT online now, right? So they can see where their NRT is in the shipment. Opting in for text, they can turn off and on text support, email support. And when they go to the online portal, there's videos, there's articles, there's additional information. We also include stress management, nutrition, and physical activity, because we know that that is important for your quit journey, to be healthy at the same time. You're going to support those withdrawal symptoms. And I already mentioned the online tracking of NRT, and also if any of our states offer financial incentives, are able to see those on the online dashboard. Next slide. So here are the key milestones when helping people that our coaches help our participants get through. So if you're familiar with the stages of change, our coaches help folks get to those stages of change. So maybe someone it comes in, they enroll, they're just thinking about quitting. And then step one, working with our coaches to build that confidence, preparing to quit. Step two, with the coaches, making your plan, right? Maybe they're helping them make that plan. They're going to encourage them to take to practice mini quits, and that's step three. And then those mini quits are going to help them get to that quit date. And we hope to get folks on the phone or engaging in a session on their quit date so we can support them on that date. And then 4 through 6, as you see here, are really just supporting the participant in getting through withdrawal symptoms. So by the quit date, they have their NRT. Are they using the NRT correctly? Helping them embrace those healthy lifestyle changes. And hopefully by the end of their session that they're tobacco free. And by doing all that, right, anyone can call in at any time if they need support and making sure they get that NRT delivered and that is working for them effectively and efficiently. And they can access anywhere, like, right, I've mentioned phone, text, and online chat support. Next. Here's what the dashboard looks like. So there's different quizzes and games and things to just keep them engaging in the platform, bring them back. So interactive tools, the digital coaching, the online ordering and tracking that I mentioned, and then they can go in and they can personalize their quit plan and have a place to come back to and make that goal, see that goal, and make it tangible. Next slide. So here are the NRT offering and how it works. So to get the NRT, the individual has to go through the NRT screening and enrollment. If for any reason there's a medical condition that needs a medical override, we get them that information, we get them that letter to get to their provider and have them send that back to us at RVO so we can get the NRT. Coaches are going to educate them how to use that NRT. So to minimize any side effects from NRT and make sure it is helping them to be successful in their quit attempt. As I mentioned, any health risks that may need the medical override, we go through that. And then personalizing the NRT for them. The state of Louisiana offers patch gum or a combination of patch and gum for a limited time right now. And then we're going to order that, get that order for them and get it out to the participant within 3 to 5 business days. Next slide. So in summary, the standard program is 5 sessions in NRT. Behavioral health and pregnancy and postpartum are 7 sessions in NRT. Our Live Weight Free program for young adults offers them NRT for 18 and plus and is available to our teens. And I do want to mention that right now, the Louisiana Quitline is offering a limited time offer of 12 weeks of combo NRT. This is going to run from now through June of 2026. So it's a really great time to take advantage of this opportunity. The state is meeting best practices, recommendations of the 12-week recommendations. So definitely, if you have folks, if you're a provider online, if you're someone who is looking to make a quit attempt, this is a great opportunity to use this limited time offer. And I don't know if we're taking questions now or if we're saving them for later, but happy to take them. That's all I have.
Thank you, Poe. Just at this time, just a reminder, if anyone has any questions, to please place them in the question and answer box here while we're presenting, and we'll get to your questions at the end of the webinar. So thanks again, Poe, for that great information, great detail about what the Louisiana Quitline offers. It's not just a phone line, but it's additional services and additional ways to communicate with a quit coach and getting those tips and strategies that's tailored to an individual to help them quit. So in addition to just details about Quitline services, we want to focus on also showing you, the community, how we're connecting our services to you. First of all, providing those tailored services that Poe mentioned, focusing on behavioral health, pregnant and postpartum women, and also youth, focusing on youth and young adults, menthol users. So we know certain populations have been, menthol cigarettes have been promoted within those communities for years, for decades. And you're talking about the Black community, also the Native American communities, and youth, as youth start using tobacco because menthol is a product that helps them easily use those products and then get truly addicted to nicotine with menthol. So tailored services are for, populations who still have that high prevalence of tobacco use. Even though just the general public, the prevalence has decreased, but in certain populations, we know that prevalence is still there. Marketing is still targeting those specific communities. So definitely that's how we're connecting to community through the Quitline, is providing tailored services. And when a person utilizes the Quitline, there are a few questions that the coaches ask them in an assessment, and then they ask what their tobacco history is, how they use tobacco, and those things are used to help identify a specific strategy for that person. It's based on their personal tobacco use. In addition to that, how we're connecting communities is the promotional campaigns that we do. You just saw two videos at the beginning of this webinar that has been used for promotion, especially on social media, and it's actually on YouTube. So you can search those videos on YouTube and share it with people that that need help to quit. Also, providers can go to a YouTube channel and show, why you're in clinic with the patient, just as motivation. Community outreach, we do across the state. TFL has regional managers. Also, LDH Well Ahead, our health department, has regional coordinators in their areas too. And so we do a lot of community engagement as far as connecting communities to quit services. Accessibility. Poe talked about how it's a larger reach, and Quitline Services is successful largely in reaching a big population. So it's a greater reach to those with limited mobility that live in rural areas or remote areas, even though we know that there are some in-person services happening across the state too. And that brings me to collaboration, how we work with state health department, also stakeholders and community partners in order to work together in cessation and helping Louisiana tobacco users quit. Next slide. So, talking about tailored services and reaching those populations, priority populations within our state that we know are disproportionately impacted by tobacco use. And this just shows you just some current numbers within the last year of the number of outreach events that we've done in those specific communities, making sure that we're trying to reach those specific populations. And you can see it listed here. Just some examples. We've done outreach along with community partners, communities of color, Southern University Ag Center, and reaching folks at Bayou Classic, at local HBCUs across the state, and educating those communities. Also, the Latino and Hispanic population across the state. We've done events for central Louisiana and Alexandria area. Also, here in the southeastern part of the state, reaching that community. We've done events for Pride Prom and Pride events in North and South Louisiana. So those are just some examples. So specific priority populations, we are trying to get um, awareness about the services that's available to those specific communities. Next slide. And this just shows the community awareness and engagement, how many individuals were reached with health promotion and cessation. And this is across, and this is done by our TFL regional managers. And we have a regional manager that addresses each region of the state. And we go according to the 9 Office of Public Health regions within Louisiana. And then also I'm showing you how we had paid cessation media campaigns. So those media advertisements where, people are listening to the radio or watching TV. We've had our regional managers on news interviews across the state, especially on certain days of tobacco observances, like Take Down Tobacco Day, World No Tobacco Day, Great American Smokeout. Um, Promoting vape education. So we have vape town halls where we're promoting education and awareness around vaping. And so you see, the impressions and the number of clicks that we've had from those campaigns. And another way that we're working on connecting communities to cessation services, that collaboration and partnership we have with partners across the state. So here's some of our strategy partners that are part of the Louisiana Tobacco Cessation Collaborative. And for those of you tobacco users that are on, people, you can reach out to local organizations within your area. We have Auctioner Health. In Central Louisiana, we have the Rapides Foundation. We also have LSU's Louisiana Tobacco Control Initiative that are in certain regions around the state. And we all come together to work on how can we improve cessation services within the state of Louisiana. So we know that we have Quitline services, but also helping local organizations and healthcare centers to promote their in-person service too. So we work collaboratively where those who are receiving in-person services can actually utilize Quitline services in addition to the method that they're already using. Those who have worked in tobacco control for a long time, and I've been doing this for about 25 years, we know that using different modes together or collaboration of different ways to help you quit proves a person to be successful. So we're all for working within communities and providing them with the best service that they need to help them quit. In addition to that, our Quitline, we provide and offer a list to our Quitline coaches of known local services that we know are available in Louisiana. And so when someone actually goes through the Quitline to receive Quitline services and they're interested, hey, I'm interested in maybe doing a in-person something within my community too, where our coaches can provide them with the in-person quit service that's close to their area. And they can do that in addition to the Quitline counseling. So we're striving to work together with other programs. Some of these programs do in-person, they also do telehealth. So we're being innovative and we're progressing in the way that you see healthcare is progressing from not only in-person visit to telehealth when necessary. Next slide. In addition to that, we have some collaborations and partnerships. We have AmeriHealth Caritas of Louisiana. So if you're a AmeriHealth member, definitely go through AmeriHealth, and we have actually trained AmeriHealth staff to go ahead and do online referrals for their members to go through the Quitline. So we actually assisted AmeriHealth in providing some marketing for AmeriHealth members. Members may have seen this on social media and also on the website. We've also developed a workflow with their personnel and case managers who are talking to patients to refer to Quitline services. In addition to that, we are currently working with the Louisiana Cancer Prevention and Control Program. So those who are familiar within your communities with this program, they can also find out about Quitline services through them. We are working with LCP to add lung cancer screening eligibility. It's currently a part of the Quitline. If someone calls the Quitline and they're eligible for lung cancer screening, the Quitline coaches will provide them with the resource, a local resource here in Louisiana, in place of a national resource, but someone locally that can help guide them through navigating for lung cancer screening. And we're continuing to work with them to enhance that and make it improve the way that we're reaching people through the Quitline for lung cancer screening. We also are working with South West Louisiana Area Health Education Center, known as SWALAHEC. So if you live in Southwest Louisiana, South Central Louisiana, and you're familiar with SWALAHEC also can provide you with more information and refer you to the state Quitline. We are working with SWALAHEC as far as letting people know, educating communities, engaging them into quit services. And so you can reach out to that organization also. In addition to that, we have healthcare provider referrals. We do an online portal training where providers are trained to go ahead and do referrals on an online portal. Next slide. And if providers on this webinar is interested, please go through the Connect to Quit provider training, and you can get to that training from the link that's here on the slide. And these slides will be provided to everyone who attended via email, so you can have access to it. But if you go through that training, it's very short and simple, but it shows you how you can refer a person directly to the Louisiana Tobacco Quitline. And the way you can get there, you can also go to quitwithusla.org and click on provider resources, and you can get to that training. In addition to that, we have a brief tobacco intervention training that RVO, our Quitline, actually provides our providers within the state also. So there's resources for providers, just to let you know that these are opportunities you can use within your clinics to refer patients who have been screened. And this would be a part of the treatment after you screen them and identify them as a tobacco or nicotine user. Just want to re-emphasize what Poe mentioned before. Please take advantage. Please spread the word. Let tobacco users know within your communities that we have a limited offer from January to June to provide basically a complete regimen of the nicotine replacement therapies, which is a combination therapy, including the patch and the nicotine gum for 12 weeks. So just wanted to do that reminder. Next slide. And here are just resources regarding what we spoke about today. So anyone can access Quit With Us LA via phone by calling 1-800-QUIT-NOW. They can enroll via web at quitwithusla.org, or they can get started by texting the word READY to the number 39141. Other resources here are Tobacco-Free Living website, Well Ahead's website, which is the Louisiana Department of Health. For schools, because we're talking about not only smoking and tobacco, but also vaping and other types of nicotine use that we know young folks and young adults are utilizing. And those rates are also increasing. So, other resources, Live Vape Free is for teens and young adults, a completely text-based program. We have a Next Era program at TFL that we focus on youth, where we have a youth advisory board and we educate youth with Next Era. And then also Live a Free Toolkit, which is a toolkit that TFL worked on with Well Ahead in developing for schools as far as changing school policy and improving how schools actually handle youth that are found vaping. And I believe that's it. Next slide. So, in conclusion, you've gotten information for tobacco users, those who are using tobacco or any type of nicotine, including vape products or these Zen pouches. We have coaches at the Louisiana Quitline that are willing and able and capable to help you no matter what type of tobacco products that you may be using. So just encouraging everyone to please spread the word. If you're on the webinar and you're looking for help to quit, I hope this motivates you to take the next steps in utilizing services and finding help. For any providers or community organizations who work with communities, please spread the word. Please look to our resources and finding out how you can refer those to services. Thank you. And I'll turn it back over to Michelle.
Thank you, Chriselle and Paola Apo. I was looking at the Q&A. We just had a thank you in there, and I didn't see any questions in the chat. But I would just prompt a few questions for you all. When it comes to the Quitline, and to all the different changes from, let's say, from the pandemic to now, do you see an increase in callers, and services being offered to people, or is it still about the same?
So since COVID, there was a dip in utilization. Sorry, Chriselle, were you going to jump in?
No, go ahead.
Oh, okay,
Take
okay.
your time.
We did see a dip in utilization, but we are climbing back up slowly but surely. So numbers are starting to go more into what they used to look like before COVID. So slowly but surely, it's making its way back. Remember, COVID was a stressful time for folks. It was not a priority, even though we know it would have benefited, benefit their health before COVID started. But we're working our way back up.
Okay, and is there any new changes going on with the quit services as far as what's being offered to them?
So additionally, probably the biggest one is going to be the ability for the live text. The live text was the biggest one, whereas before it was like single word text. Now it's more of an interactive text.
Okay. I have a question in the chat. It says, what cessation services are available for youth?
Okay. For youth, youth can utilize, we know, so just, and this is just from the studies that RVO has been doing regarding youth and how we improve services. We realize that youth, do not make phone calls. So youth do not call 1-800-QUIT now, but youth are online. They go to websites and youth, they're on their phones. So texting, that's the way to go. So for Quit With Us LA, we have youth services for ages 13 to 17. They can go to quitwithusla.org and utilize our website. They can text that number to get started and then end up, getting services via website. We also have, and for Quit With Us LA, that includes any type of tobacco, vaping, any other type of tobacco, other than smoking and different types of tobacco, including vaping, and we also need to include Zen. So any type of tobacco or nicotine products, because Zen is a product that is definitely popular. It's been growing in the last year amongst youth. And I'm saying Zen because that's a brand name, but it's the nicotine pouches. And basically, they use it like how a person would dip tobacco. They basically sit it in their gums. Um, so that, and then also Live Vape Free that Poe spoke about. Live Vape Free is a completely text-based program. As of now, they can go to the Live Vape Free website, livevapefree.com, to access services. Soon we will have a new text number, right, Poe, for Live Vape Free, where they can get started with just the text number. But Live Vape Free, there's two types of Live Vape Free. So according to their age, they'll get services for teens, 13 through 17. And then there's a Live Vape Free young adult, because we know young adults, they fall through the gap. You know, you have youth and you have young adults. But even though 18 to 26, they're adults, they're still young adults. So tailoring services towards them is important. And based on the research that RVO has done, notice that that age group needs tailored services. So with Live Vape Free, they get the services through the text-based service. And then with young adults, ages 18 to 26, they their service includes NRT. Because they're adults. And Poe, if you can remind me how many weeks they usually get, is it 4 weeks?
Right now, you guys are upping it to the 12.
12 weeks.
Mhm.
Got it. So 12 weeks for Live Vape Free. So those are the services that we have for youth, and including youth, we're talking about young adults also. And just let me add, for Live Vape Free, it's it definitely captures the youth's attention. There's quizzes, there's a group chat, there's activities to help them assess their nicotine use. And so it's very interactive for youth and engaging.
I think one thing I didn't mention, or maybe we didn't mention, Chriselle, is that all of this is confidential. We don't, we may ask insurance, like what insurance do you have, but we don't share that. We don't collect their, member ID or anything like that. I just wanted to make sure to let you guys know that, because sometimes people are concerned about, that type of information. So unless they are we also work with employers across the nation. So unless they're part of that group, everything is we're not going to share that.
Yes, good to know.
I did see a question about quit rate. So I would have to go, or Chriselle, we would have to go pull up the evaluation, the latest evaluation.
Yes, yes. Okay, it looks like you responded to that one.
All right. So the question was, what is the success rate of the quit program? Also, what is the relapse rate of clients that have completed the program? So I know that's something y'all will have to dig up. And then we had another question, how can existing cessation strategies be adapted for specific populations?
So let's see, say it again, Michelle.
How can existing cessation strategies be adapted for specific populations?
So depending on, and this is just coming from my experience in tobacco cessation counseling, um, depending on So strategies are tailored based on the person's assessment, the questions that they're asked in the beginning regarding their tobacco use, their nicotine dependence level, um, like their routine, identifying what their triggers are. So that's a core part of counseling and coaching for those who are going through the services. In addition to that, identifying if, whether or not if they're a behavioral health patient, if, and not necessarily patient, but asking them those questions, that if they know they suffer from anxiety or depression, that's utilized within the counseling. It can also help with identifying what type of NRT or medication is best for them. So that's an example of how you're adapting for specific populations. Any additional response you have, Poe?
No, I think you did a great job there.
Let's see.
It's not a question, it's a comment. It says Southwest Louisiana Area Health Education Center, Swallowhead, is planning an in-person provider training session in March. Healthcare providers are welcome to email valerie.thompson@swallowhead.com for more information. And also copy and paste the comment in the chat for everyone.
Great. Thank you, Valerie.
All right. That is it for our Q&A. I want to thank Chriselle and Poe for speaking with us today and giving us all this information about the Quitline, everything that you all are doing with the state, and just all the ways that we can connect with our partners and to help providers and individuals that are current smokers, or those that know someone that smoke, or those that are just on that journey of just finding new information about cessation and the world of tobacco. Again, my name was Michelle Ozai, and I was the moderator for today. Thank you all for joining us today for the Louisiana Campaign for Tobacco-Free Living's Empowering People Community Series, and we hope to see y'all again soon. Thank you all.
Thank you.